All right, Kevin, I'm super fired up about this. I do think that health insurance is one of the things that law firm owners kind of just glaze over. They're like, it's just something we have to do. There's nothing I can do to keep the cost down. The cost is getting crazy for health insurance lately. Personally, I'm a super number geek when it comes to operational efficiency for the firms. And so this is a big line item in the employee benefits piece that we're looking at. It's also a crucial benefit for law firms to offer so that they can attract the right talent. But I think the program you're going to talk to us about today has a lot of added benefits for the firm. So welcome. I'm going to turn it over to you and let you guide us through what it is this product can do with and for the law firms.
All right, but I'm going to rope you into the conversation, Micki, because I know you're inside these firms every single day and you feel it firsthand. I just want to start. Many of the attorneys, many of the law firms that are in with us today, they know Sanguine as a company that's introducing them to various lead sources that we tested them out. Really, Sanguine's mission is a lot broader than that. It is really to identify best-in-class solution providers that can support the success of personal injury law firms. What we do is we test these providers of various solutions and we identify those that are best in class in whatever it is they do. So really what we're doing is we're taking the guessing game out of the vendor selection process and bringing solutions that really can be impactful to the performance of the law firms. Many of you know Anthony Bucks from working with him on the lead side. Probably few of you know that Anthony's older brother, Mike Bucks, joined about 2 years ago as the Vice President of Human Capital Solutions at Sanguine Strategic Advisors. And there was a big focus on our part in addressing the challenge that many personal injury law firms face, which is the health crisis that's happening within their walls. So some people in this webinar might be saying, health crisis? I don't have a health crisis going on here. But the reality is that all of the personal injury law firms that I've seen and I've seen firsthand, they do have a festering health crisis that they may not necessarily be fully aware of. They may kind of be putting their head in the sand a little bit and ignoring some of the warning signs that things are going on. But you have to remember that the people that work within the four walls of your law firm are your most valuable asset. Because if you don't take care of them, they can't take care of your clients and your cases, and their performance diminishes and then hurts your overall enterprise. We're going to talk a little bit about some of the more visible things that are happening within the health space in terms of rising costs, which I think we all feel. But we're also going to talk about some of the hidden things that are happening within these law firms. So we all know that people are under pressure, and I just want to make sure everyone can see this. Attorneys are experiencing stress levels 23% higher than the average run-of-the-mill employee. And I think we all understand exactly why that is. I mean, think about what we have going on every single day. We're working long hours, 10, 12, 15 hours a day. You got a big case coming up. You're neglecting everything about your health while that's going on. You're not eating right. Oh, I'm working 15 hours. I'm going to just run down the block to McDonald's, right, and grab a meal because it's convenient and it's easy. And I just don't have too much work to do. 9, 10, 12 hours a day at my desk. Right? Sedentary behavior is one of the biggest precursors to pre-diabetes and diabetic health-related issues. How many people here have woken up at 4 o'clock in the morning, 3 or 4 in the morning, thinking about the case that they're working on and they can't go back to sleep because they're worried about what's going on in the case, skipping meals, right? Or putting off going to the doctor, right? Like delayed care because I'm just too busy. I don't have time to go to the doctor. So there's so many things within our industry that lead to attorneys and their staff really kind of neglecting their health. I don't know, like Micki, I'm sure you see this all the time within these law firms, right?
Yeah, and it's so much more than just the attorneys, right? The non-attorneys that work for these firms, like they're there supporting these guys, and then they have guys and gals, the attorneys, and then they have to go home and do full family functions, right? So there's so much pressure on the non-attorneys as well that it's just festering inside the firms. And unless you're an intentional communicator with your team, you may or may not know all the things that are going on inside of their lives. And so I think this is, something that gets overlooked too often. Mental health is a true issue as well.
Well, and whether we'd like to admit it or not, Micki, as attorneys, which I am as well, kind of our personality type, we tend to be a little bit towards the type A side of the spectrum, cause some of these things ourselves too, right? Because we're creating the high stakes, we're creating the deadlines, we're putting the pressure on our employees. We're telling them that they have to work these longer hours. So, they feel responsible, us. I think many from a personal standpoint, they're very dedicated employees. They feel like they are a responsibility to you as their boss to make sure that they're delivering, but they're putting their own health kind of second fiddle behind the firm, right? Because they feel like they have a responsibility. So it's a great thing to have employees
Yeah.
like that. But we got to make sure that we take care of our employees as well. Otherwise, it's going to come back to bite us, right? So I alluded a little bit before you look at the slide, 10 to 12 hours a day sitting, right? That's not good for you. You need to be up. You need to be moving around. You need to get the blood flowing.
Especially working from home nowadays, right? Like
Yeah,
as more and more people have work from home days, the risk of that is high because you don't have to get up from your chair. Like you literally walk from your bedroom to your desk and then you sit there and you just keep going because there's one more thing you can do always. I just think people are spending more and more time sitting during work from home than they are in the past when we had to get up and go to the office.
I know, and very often I work out of my kitchen and the refrigerator is right there as well. So
Yep.
it's like your food intake is
Temptation.
probably a little more than it used to be as well when you're in the office. Well, in a lot of these law firm owners, they're seeing that rising healthcare costs, right? And those are the obvious effects, right? You see that the cost of insurance is going up. Part of it's due to greedy insurance companies, but part of it is because our society isn't healthy and there's claims increasing because people are engaging in these unhealthy behaviors. And because of the environment that we create within these law firms, it's driving those behaviors, right? And then what we do is we say, oh, Micki's got a lot going on at home. She's under a lot of pressure because she's got her family. Oh, she's got this thing going on. So we start to point to these items as external, right? It's not the work environment. It's not what's going on within the law firm that's creating these health issues or these stresses. It's what's going on externally. But remember, these employees are spending the majority of their waking hours working, right? So
Yes, yeah.
we have to take some responsibility for that, right?
100%.
So the symptoms are there. Again, 60% of office workers report chronic neck and back pain. Who here has chronic neck and back pain? I know I do. When I'm sitting on my desk
It's right here.
by the end of the day, it's like the back of my neck is hurting because my arms are like out there working on the computer and stuff. So, statistic is not surprisingly higher for attorneys and obviously storing all that stress. And that leads to other impacts, right? Poor sleep, stress, headaches, fatigue. So a lot of the things that I'm alluding to on this slide. So there's also the mental component. Mental strain becomes physical pain. So a lot of us think about illness in terms of physical illness, but I think we all acknowledge that we've got a mental health crisis in the United States. And one of the big problems is that people don't get treatment for mental health. And remember, everybody says, well, I have group health insurance. But group health insurance, number one, is something that you provide to someone when they get sick. It's something you use to treat when you get sick. Preventative health is what you use in order to make sure that you have better health outcomes and that you don't get sick. The reality of our health insurance system is in the United States, it's broken. There really is no such thing as true health insurance for everyday illness. It's really just catastrophic coverage. It's what you use when you need surgery or you get hit by a car or you have cancer, right? But for most people, for the everyday illness where they're going to the doctor, you have high deductibles, right? Lots of out-of-pocket costs. You're paying co-pays for everything. So really, insurance is only a meaningful benefit to you when you are catastrophically ill or injured, right?
Yeah.
So that combined with the fact that 28% of attorneys experience depression, but they can't get mental health assistance because too much out-of-pocket costs and a lot of mental health problems are not even recognized by insurance, right? Burnout. 1 to 5 attorneys are struggling with diagnosed anxiety disorders. 1 out of 5 people in your office are dealing with diagnosed anxiety and are likely on medications, right? 21% of attorneys qualify as problem drinkers. The rate of alcoholism, drug dependency is over double within the legal industry of any other industry, right? Doctors and lawyers, right? Not surprisingly. High stakes, high pressure. This is all being passed on to your employees. And we're people-powered businesses, right? So declining health is not just a side issue. It's not something you can just ignore. It is a real issue within your firm. It is your firm because you are a people business, right? You're providing service. And Micki, I'm sure like you've seen in real world examples inside law firms, how health issues, pervasive health issues among the employees really start to affect the performance of the firm, right?
Absolutely. You can see it across the numbers. It just starts to show up. And like you said, you're always pointing to one thing or another and not really addressing the root cause of it with that person, which is often.
Yep. So, and again, this is kind of the waterfall effect, right? You say, oh, well, one person is experiencing this. I guarantee you there's other people that's experiencing it. So one person burns out, work shifts to the rest of the team, deadlines get tighter, stress increases, mistakes become more likely, morale drops, someone leaves, the firm absorbs the cost, right? And then what? Right? Absenteeism, lower productivity, higher healthcare costs, increased pressure, higher attrition, client service risk, reputation risks. It is something that, from a preventative healthcare standpoint, if you address it, you can stop the waterfall from starting, right? You can cut it
100%.
off and address these issues before they become pervasive throughout your firm. So firms spend on average about $3,600 more annually for an unhealthy employee. That is a real cost to your business, right? Increased claims, increased insurance costs, absenteeism, greater presenteeism. For those of you who don't know presenteeism, you're showing up, but you're not there. You're not engaged. You're sitting looking at your screen. You can't do your work. You're disengaged, right? And then when health issues go unaddressed, the firms are feeling the costs. Again, the higher healthcare costs, reduced productivity of your employees. That ends up leading to attrition. People are just burnt out. They decide they're just going to go do something else or work for another firm that doesn't have as high of a caseload. So you're trying to grow, more cases, but there's real impacts in terms of the increased stress, the increased health issues, not just mental health issues, but physical health issues are a manifestation of those mental health issues as well, right? And then there's a cultural impact, right? People are sick, they're not feeling well, they're depressed, they're constantly feeling exhausted. And then what's interesting to me is surveys indicate that 89% of employees don't feel that their company truly cares about them. So now we're sending the wrong message to our employees, right? We're saying, you know what, just do the work. I don't care how it affects you. How do you think your employees are going to communicate to your clients, right? That all passes down in the way that they interact. They feel that they're not cared about. How much are they going to care about the clients?
I agree.
So 56 of employees had fewer sick days due to preventative health programs. How many people here feel like there's too many sick days of their employees, right? Maybe you're not doing enough to support their health. Maybe it's a win-win, right? You can do more to support the employees, and we'll show you how you do it for free. It doesn't cost you anything.
Did everybody hear that? Like how you can do it for free? That's where we're getting to on this call. So if you're on here, don't leave before we get to the good stuff, because this really is transformational.
And I'm not trying to, sanguine means optimistic, right? And you know me, Micki, I'm a very optimistic person. I try and cast a positive light on everything. But the reality is that I've tried to convey this message very often to law firm owners about what a positive thing that they can do for their employees. And they're like, yeah, that sounds great. But I feel like a lot of time until you kind of really illustrate kind of that somewhat grim outlook about what is really going on right underneath their noses that they don't even realize, they don't want to pay attention. And I'm here trying to convey to everybody, you have to pay attention to these things. These things are going on inside your law firm right now.
And I think, for all the law firm owners that are on here listening, but I know the administrators, the HR people, they understand this, but sometimes it gets lost with the owners. Healthcare is expensive, and trying to pay for the co-pays, pay for the prescriptions, all of that stuff adds up, which just puts an extra burden on your team member when they're trying to figure out how are they going to put food on the table next week, right? All the law firms that are on this call work really hard to pay a great minimum wage or a great living wage for our team members, but the little unexpected things add up so quickly, and then that compounds the already happening things in their lives. So these extra expenses that come even when you give them a great health insurance plan, it doesn't cover a lot. And so they still end up with these co-pays or these extra expenses. So
Yeah.
anyways,
Well,
keep going, Kevin. Sorry.
and no, I mean, it's true. And think about what is the single largest expense in your law firm besides your actual payroll? It's your healthcare cost.
Yeah,
So you're paying an
100%.
enormous amount of money in order to subsidize healthcare for your employees. 95% of your employees will never even use that because they're coming out, everything's out of pocket, everything's under
Yep.
their deductible. Like, they'll get, the $40 copay. Like there's cost associated, and it's a real out-of-pocket cost for your employees. You might say, well, that's the employee. But expenses that pass through to your employee, they affect you because the employee is then coming to you saying, my cost of living is increasing. I need to make more money. Pay me more money to do the same work. And I don't blame them for saying that, but it's because their healthcare, a number of different costs, their healthcare costs are so high. The reality is that there are tools out there. 25% of ER visits could have been handled in primary care, virtual care without a visit. You know what the cost is, the out-of-pocket cost to employee for an actual ER visit? It's about $1,500 out of their own pocket. That's with insurance, right? One preventative health visit, you know what the cost is? Zero. So, I think out-of-pocket costs in the United States for ER visits, $55 million a year in out-of-pocket costs to patients for ER visits, that many of which could have been avoided. Preventative health gives you as a law firm a way to act before the dominoes fall, before you start really seeing the employee impact in their productivity, in their morale, and in their actual health. Preventative health is what you do to not get sick. Your health insurance is what you use when you're catastrophically ill. What these types of programs do is they help your employees reduce avoidable illnesses, prevent diabetes, address mental health issues before they lead to missing work or worse, right? They build a healthier and more sustainable workplace for you. 72% of employers saw a reduction in healthcare costs after implementing a preventative health program. There's real savings to your law firm. There's all kinds of productivity. There's a lot of soft savings that are harder to measure, but these are real savings in costs. So law firms are already dealing with the rising healthcare costs, rising insurance premiums, pressure in a competitive market, right? You want to do everything you can in order to compete with the next law firm. So offering a preventative health program actually allows you to have a recruitment and retention tool that many of your competitors don't have. It's going to allow you to compete in a very competitive labor market, and it will make you feel good. It's the right thing to do. You get to protect your most valuable asset, the people you care about, the people who have devoted themselves to you for years. You're going to strengthen retention and support better performance. So the crisis is already here, right? So waiting is only putting off the inevitable, right? All right. Early intervention protects the firm's most valuable asset, its people. So again, the real numbers, 56% of employees had fewer sick days because of preventative health programs. These are real numbers, right? I'm not making these up. 10% increase in productivity on average, right? That's 10% less employee costs, right? If you 10% less employees in order to get the same work done, what is your payroll? That's another, you do the math. You save 10% of your payroll. Employee turnover rates are 20% lower than their competitors. What is the cost of losing a paralegal? What is the cost to your firm?
It's a lot.
Yeah, if you can avoid that by providing a better set of benefits and having more engaged employees, it's huge for your law firm. So just to give you an idea, the Sanguine preventative health solution, everything you see on the left here, it's all included, no copays, no copays.
Everybody heard this. There are no copays for this stuff. This is big for our team. And I think inside of law firms, when it's open enrollment time for health insurance, we don't spend enough time educating our team on their benefits and how going to the ER for a hangnail or for every little thing is going to increase the cost for everybody. But we as employers have to deliver the bad news every year of how much they're going to have to pay out of their pockets is going up every year. And so the employees often get mad at us because the rates have gone up. And as a law firm, you guys all know we're not able to raise the percentage that we're charging our clients at the same rate that the costs are going up of keeping our employees engaged and healthy and happy. So we have to spend more time talking about these types of programs that Kevin has to tell you about, but free. Like we need to show our employees how they can get some free health care that's not going to drive up our overall big health insurance policy. Sorry,
And
Kevin.
I want to make the distinction here between what is preventative health and what is wellness. Wellness, gym stipends, step challenges, smoothie bars, those are nice to have, right? But it's not preventative health care. It's kind of giving someone a gym membership doesn't mean they're necessarily going to use it. These are real practical tools that your employees can use to prevent illness or prevent illness from getting greater, right? There's diabetes counseling for free. There's nicotine cessation counseling for free. There's early diabetes detection for free, right? There's all these different things. And by the way, this is only about 8 or 9 of about 30 to 40 different preventative health tools that are all included. This is just a sampling of some of the things that are included. There's actually even veterinary care. So, copay free veterinary care. So there's there's pharmaceuticals, over 1,000 different generic pharmaceuticals for free, right? So there's a ton that is not here, but I just want to make the distinction between kind of what is wellness. You say, oh, well, we've got a wellness program. We give them a reimbursement for a portion of their gym membership. That's not preventative health, right? And then historically, wellness programs get very low adoption. So just give me ideas, $0 copay for primary and urgent care, 24/7 virtual physician access. You say, well, we have Blue Cross Blue Shield, and we already have that through Blue Cross Blue Shield. Okay, what's the copay? $30 to $40. So when when their kid wakes up at 3 o'clock in the morning with 102 fever, and they can go to Blue Cross Blue Shield and they can pay their $30 copay and get online, the doctor will write a prescription for them. Then they'll pay the $30 copay to get their prescription for their kid, or they're presented with this free program and it's a $0 copay, and then the prescription is $0. Which do you think your employee is going to use? They're going to use the free program. And how do you think that that's going to affect the claim history when you come up for your renewal next year? It's going to drop the number of claims that were submitted through Blue Cross Blue Shield, which affects your employer-sponsored health insurance premium rates. And so it does actually save you more money when your employees actually gravitate away from your current group health insurance sponsored program.
And I can attest to it. So CJ's had this program in place for, I don't know, Kevin, over a year at this point. I travel a ton, and knock on wood, I'm rarely ever sick. But when I get sick, it's usually in a different city, away from my PCP, and I'm usually thinking, I don't even know where the closest urgent care is, right? So just a couple weeks ago, I had this nagging cough, aching feeling that I just couldn't get rid of. So I called the program, and within minutes, I had a virtual appointment, a doctor on the phone with me, FaceTime video call, and he called in a prescription for me, and it cost me nothing. And I was in a different city. I didn't have to leave my hotel room. It was fantastic. I was like, I will never go to an urgent care again. Like, this is the best thing that CJ's ever done for us from a healthcare standpoint.
Yeah, it sends the right message that CJ's willing to do that for you. I will tell you also, this program covers up to 7 people in your household. So there's no restriction on they've got to be your son or daughter. They have to be a dependent. You could have your mother living with you, or one of your employees give you a mother, their cousin, whatever. Just has to be a household member in order to benefit up to 7 individuals. Guess what? Under this program, fully financed through payroll tax reductions associated with the implementation of the program, you will be able to give every single one of your employees up to $150,000 guaranteed issue universal life insurance that pays a guaranteed return annually of 3.5%. No blood tests. They get automatically approved. So now you as a law firm can give for free health insurance to every single one of your life insurance to every single one of your employees that actually builds cash value, right? So again, this is preventative. Every employee gets a state-of-the-art preventative health care, and they get guaranteed issue universal life insurance. So just want to bring up one actual use case. Gravis Law is a firm that we work with out in the Pacific Northwest. They're a large family law firm with offices in about 7 or 8 states. They have about 175 employees now. They were much smaller when we originally enrolled them. They have about 85% enrollment at this point. But through the implementation of the program, not only on an annual basis are we saving them over $50,000 in reduced payroll taxes, but that is net after the cost of the program. Through implementing the program, it creates payroll tax savings, which are then used to subsidize premiums on the life insurance and the cost associated with the preventative health program. There's an excess. After those costs are paid, net of the costs of the program, the employer is receiving about $650 per employee annually in excess payroll tax savings above and beyond the cost of the program. So you as an employer actually get paid. You have a financial incentive to actually implement a program which will improve the health of your employees.
I want to make sure everybody heard that, right? Like the law firm can add to their bottom line while still giving this program to your employees for no cost to the employees, really. So
Their
it's
take-home pay,
very,
your employees' take-home pay remains exactly the same. No difference, which I know is always the big blocker. If their take-home pay is going to go down, they're never going to receive an incentive, about $650 annually for every single employee. Every year you have the program, and you will improve your overall total rewards program, right, for recruiting and retaining employees, because you have a list of about 30 additional benefits you're now giving to every single employee, and you will have happier, healthier, more engaged employees that love you. So,
Kevin, this is great. Thank you so much for sharing it with us today. If you're on this call and you don't scan that QR code to set up a time to talk to Kevin and his team about how this program can benefit you or benefit your team members, because remember, it's a dual benefit here. It's benefiting the law firm from a financial standpoint in many ways, right? Your bottom line is going to increase with the excess that'll be available, and you're going to hopefully reduce your overall health insurance costs by bringing down the premiums on a go-forward basis, because you don't have a bunch of small claims, and small in a big picture, right? Still expensive to your team members to go to the ER all the time, the urgent cares, the things of the world. When we're not submitting all those claims, then we have fewer claims on our claims list when we go to do open enrollment the next year for our health insurance, which helps us keep those costs the same or bring them down, hopefully, for our team members' true out of pocket for health insurance. And then on the employee side, like this is a huge benefit for them. You just have to educate them on what this can do for them and educate them on how this doesn't cost them anything to you.
well, and Micki,
Kevin,
like we can help roll this out. And this can be a huge, like you can make a huge announcement and this is like a celebration within your firm. Like we are focusing on the well-being of our employees. We're going out of your way. We got this program for you. It's no cost to you. We're giving it to you for free because we care about you. It is about sending the right message to your employees that they're investing in the firm and you're investing in them.
I agree. And it's just, this is something that we can do as all the law firms. Kevin, is there anything that the law firms need to be prepared with when they call you to talk about this for their firm? Any numbers they need to have together, or is it pretty simple?
Pretty straightforward, very light lift in terms of, some people, they're always worried about how much investment we're going to have to make in time and energy. Very light lift. We can put proposals together very quickly. Implementation, you don't have to wait for open enrollment or anything like that. These programs can be implemented at any time. Implementation can start literally within 30 days. They're very, very straightforward, easy to implement, low lift types of programs.
And I want to just say this for everybody that's out there listening, because I know there's some non-law firms that follow our podcast and things of that nature. Program has been around for a while and it's used in major corporations around the country, not just law firms. Correct, Kevin?
That's right. So the structure was actually facilitated through the Affordable Care Act, right? There were certain wellness provisions that created incentives for businesses to promote better health outcomes. When the government's trying to advance public policy, like improving the population's overall health outcomes, how do they execute those types of public policy changes? Through employer incentives, because it's the easiest way to distribute them. So through these structures, these programs have been created. They've been around since 2016, right? and they've been broadly and widely adopted across Fortune 500s. Of course, what is usually the case, it is the SMBs, right? Small businesses of the world that are kind of the last ones to be privy to these. We have multiple legal opinions supporting the compliant nature of these programs. Major corporations are adopting these programs for their own employees. It's now time for small businesses, particularly personal injury law firms with, risky health profiles, to start adopting these programs.
Thank you, Kevin. I appreciate it. I'm sure everybody out there listening is probably thinking about some of this and wondering if it's the right fit for their firm. I would just encourage you to reach out to Kevin. You have the QR code there on the screen. Kevin, how else can they reach you? Is there a slide that has your contact info on it?
Well, they can email me at kevin@sanguinesa.com. It's SANGUINESA.com. Or they can visit our website at sanguinesa.com.
Perfect. And if you can't find it, it'll be in the show notes for this, and Stephanie has that available to send out, and you can always reach out to me directly. I'm happy to share that with anybody when they need it. So, and again, this is one aspect of the things that Kevin and his team does. This is a very important aspect. That's why we wanted to bring it today, make sure everybody is listening and thinking about this. I know that open enrollment may have just passed for some of you, and you just saw how much your insurance premiums went up again. And for others, it's coming, right? Like you're getting ready to go through open renewal, and you're going to have to see these and face these costs again. So be thinking about it. Think about how it can help your law firm, and then reach out to Kevin. And then reach out to Kevin for other things too, right? Like ask him what else he has that can help PI firms. What else is he seeing personal injury firms use for either more cases or more cost savings or better efficiencies inside of their firm? If there's a program out there, Kevin's probably seen it and seen how it's worked for other firms and can give you some insight to that. So Kevin, thanks for taking time to join us today. I really appreciate it.
Yeah, it's my pleasure. It's my privilege to be able to contribute to your community. And, I personally, I get a lot of joy out of being a fixer, helping people find ways to fix the challenge that they're facing within their businesses. So this is a great opportunity. I appreciate it.